Good evening. My name is Subbarao Myla. I'm the medical director for the Jeffrey M. Carlton Heart and Vascular Institute at Hoag Memorial Hospital. I am so delighted to be able to present this timely topic on wearables and health and fitness. Without much ado, let's get into the slides now. Humanity has tracked for the purpose of thriving and surviving for millennia. As you see the North Star, that was the classic prototype, tracking predators and prey, tracking celestial objects for the purpose of navigation while sailing, crop plantation to find the right timing, and warfare, of course. The Chinese have learned to conquer the Mongols when they would attack at nighttime in pitch black. The lunar eclipse has an interesting historical point. Many of the phases of the moon had historical and religious significance. One most important is Christopher Columbus. One of his voyages to America, he was lost on an island in Jamaica. This is 1504 in March. As the supplies were dwindling and the natives are restless that the settlers are not leaving, when there was a revolt, Columbus had the almanac from Germany. He knew precisely when the total eclipse will take place for a 45-minute period. He took advantage of that, threatened them that God will punish them if he and his men were not fed and nourished. So the natives were scared, petrified by Columbus' comments and how predictable his sayings were, to the point they supported him. Historians say if this did not happen, he would not have discovered America. Time tracking has been there for ages. Meet you at high noon is a classic comment because nobody has a clock. Then came the sundials, clock towers, pocket watches, wristwatch. The wristwatch made its appearance in World War I when the soldiers had to time their attack in the trenches. There was no time to pull it out of your pocket, so they wrapped the chain around the wrist. Time is now incorporated into the clocks, computers, microwaves, and ovens. It has become an item from luxury to utility, and then the smartwatch is born. You can see a series of historical artifacts, starting top left with the Chinese abacus watch, the Nuremberg golden egg, and then of course the pocket watch. The smartwatch, for the first time, ushered in the connectivity, the use of sophisticated high-power computing, the apps, ubiquitous Wi-Fi to its benefit, and that is something we're going to explore. Healthcare tracking likewise started with family planning in the beginning, so menstrual cycle was tracked. Infections were prevalent in the Renaissance period, so temperature as an indicator of fever and infection was tracked. And more recently, as the salt and high blood pressure connection was widely educated in public health measures, blood pressure machines were becoming a household item. Fitness tracking likewise started with the very first marathon running by Phidippides, who ran 26.3 miles to send the message to the Athenians that the war against the Persians is won resoundingly. It is a political stunt that cost his life, but yet we continue to enjoy marathon running. It's around the Tokyo Olympics the pedometer was invented. They called it Manpokai, meaning 10,000 steps. Another political gimmick. There's nothing magical to 10,000 steps. Health benefits pretty much plateau after 6,500 steps. Definitely there is a linear correlation between the number of steps and the amount of exercise we do to our cardiovascular fitness and longevity. And yet the marketing scam is more for the 10,000 steps as a nice round figure. If you pause for a second and say, why do we need these wearables and sensors? It is based on the innate nature within us to discover and then make a decision, and then we deploy and deliver for the results. So it allows us the early detection. Automatic reporting would make it easy rather than having you to input each and every element. The automatic context sensitive feedback some of these devices are providing. And once you make the decision, it allows you to call 911, or in the future there will be artificial intelligence embedded in the phones. And now you're seeing when you ask for Siri and Alexa about the weather and restaurant recommendations. And then of course, how do we take advantage of this? Lifestyle coaching and treatment will be the center stage if we have the devices available to tell you the appropriate relevant information. We need to understand the difference between the medical grade and consumer grade monitors. The medical grade monitors have high accuracy, reproducibility, multiple channels, and there are devices that are put on the skin to look for heart rhythm changes, and there are some, as you see in the center inside a palm, a tiny little sensor that we can inject with a syringe under the skin near the breastbone, and it tracks for 3 to 5 years the heart rhythm problems, somewhat like the James Bond getting a chip. The consumer level monitors, two of them now that are popular is the Apple Watch and the Cardia Mobile. But there are two others that just received approval, including the Samsung and the FitBit. All of them provide a single channel EKG. With Cardia, it is up to 6 channels. The more channels, the more activity and more accurate you are. Apple Watch is unique in this area because of the trifecta benefit. It is a fitness tracker like many other things like Fitbit and Garmin. It also allows for a fall detection, which is very important in the senior population. And then of course the detection of one important arrhythmia, atrial fibrillation. You see, stroke is a major cause of death and disability, and it alone taxes the healthcare dollars to the tune of 25% of the total expenditure every year. Apple Watch has a unique ability to detect in a single channel if you have atrial fibrillation or not. It has its limitations, mind you, and other devices are catching up fast. In addition to this, the Apple Watch and the applications that come with it are good in tracking blood pressure, how good you are managing your calorie intake, how they are connected, medication compliance, and after a heart attack, Apple Watch app has shown to reduce readmissions and complications. Apple Watch and a smartphone application study from Stanford enrolled about 450,000 population based and found that it can reliably detect atrial fibrillation, an important precursor of stroke. And that is the main reason in applying the Apple Watch, the medical wearables, to detect AFib at an early stage and provide the treatment. Fitbit also has many benefits. There is a Fitbit that fits a budget for many. It is carrier agnostic, meaning you can use it to pair for the iPhone or Android phone, whereas Apple Watch connects only to the iPhone family. It is very simple to use, and if you are more activity prone, Fitbit may be better in that sense. And the latest cousin to join this is the Omron blood pressure smartwatch. This has a tiny inflatable bladder inside, and when you push the button, the bladder inflates and gets the pulse pressure and displays the blood pressure. Besides atrial fibrillation, elevated blood pressure now is the most common cause for heart failure, stroke, and heart attacks. 40% of the American adult population have high blood pressure. And we all hate to admit that our consumption of calories and salt has increased. Either it's because of the endless buffet, or we treat this as equivalent for a comfort food. Regardless, tracking blood pressure is extremely important. Remember what they say, what you don't track, you can't change. With all the plethora of wearables coming, where is the space on your wrist, you might wonder. Let me take you back to the history of 9,000 years ago. Here is the statuette figurine uncovered in northern India, Mohenjo-daro, Harappa. Many of the women carried so many wearables, they called them bangles, of course, and that is hugely popular in India even now. A look into the future, you will see the wearables revolution has just started. There is the Nubia Alpha that allows you to change the screens. It's a foldable iPhone, miniaturized, and that fits around the wrist. And then, of course, the tiny ring and a wristband that can project the entire iPhone image on your forearm. You just need to remember to shave it every day. And then, of course, the digital bangle. This has enormous popularity in Southeast Asia in the prototype testing. And the final one that's exciting is the ring. It's no longer the iPhone or Android in your pocket. It's no longer the watch that is smart, but now it is the ring. One particular ring is the Aura. Aura now is commercially available. It is unique in terms of the ability to track the sleep, activity, and your performance level based on the sensors that are on the inside of the ring. And last but not least in this wearables is the BioHeartbeat heart failure wearable monitor. This monitor connects through Wi-Fi to a little transmitter at the bedside. This allows you to continuously monitor your blood pressure, heart rate, and oxygenation. All of them are quite useful in detecting and treating and monitoring heart failure patients so they don't end up getting admitted frequently to the hospital. Sports feedback is equally important with the sensors embedded in the sports equipment to provide real-time, relevant, specific information in terms of your swing and how acceleration, deceleration is happening. It is also in the sensors embedded inside the gloves, so they will know the acceleration, the swing, and the pound impact in kickboxing or any of those contact sports. This has been extended now to actually monitor the muscle strength and movement at a massive scale. So imagine any of the football players having a coaching. The coach can monitor each and every individual performance of the activity and precisely tune it for that individual based on these garments worn with embedded pockets where the sensors are located. Let's go one step further. There is the virtual coaching through a mirror. The mirror is now purchased on a corporate level. It has a monthly payment plan somewhat similar to the Peloton. You can download a workout plan, you can do it on your own with a private coach, or you join a session. It is popular for those who can afford it, although the prices have tremendously come down to a consumer level monthly point of $40. The insurance company is not silent. They are taking notice of the value they can have in motivating individuals to be active and healthy by monitoring their vital signs through the Apple Watches. So incentive programs are around. Interesting is the John Hancock. It will give rebates or credits for purchase on Amazon provided individuals submit their activity, fitness goals, achievement through the Apple Watch. Many of the health insurance companies also allow you to own the Apple Watch completely free by simply following the regime and protocol. Now, I can tell you human mind is always devious. Where there is a will, there is always a cheat. So there were cases where people were manipulating the Fitbits to crank up that 10,000 level. And there were hilarious YouTube videos you can enjoy watching where you can connect the Fitbit to the drill or connect it to a very active young dog at your home. Definitely not for those who are tired and sloppy. Where are we heading in the future is the medical technology tattoos that are removable, applicable. These tattoos allow for skin temperature monitoring, something quite useful in a child who is having fever, and the mother can keep an eye on the child's temperature no matter where she is through the iPhone. And the opportunities are endless in this regard. And on that note, let me share with you the dark side. And this is something that is frightening to some who watched the Netflix show The Social Dilemma. October is the Cybersecurity Awareness Month. It is very important to track the devices and make sure we change the passwords of the iPhones, have them securely available. But these devices can potentially be hacked. There is the fear of the ransomware that can affect the healthcare, loss of privacy, and any of this amount of material sold on the darknet for a fraction. I want to end this talk by sharing with you some of the exciting developments happening with the COVID pandemic and how the medical sensors and wearables are helpful. There is an excellent paper written by the authors on wearable sensors for COVID, a call to action. COVID is essentially a pulmonary respiratory infection. In the early stages, the symptoms are mild, but subtle changes in our vital signs happen, and that may include a rise in temperature of the skin. The heart rate goes up. The heart rate variability drops because of this stress, and oxygenation may change. All of these are very crucial in tracking an individual. Now, what these studies are doing is to combine the data from a large network of people who are in a particular geographic area or a zip code. So at an individual level, it may look like a noise, the temperature fluctuations, the heart rates, etc. But if you can show all of a sudden in a zip code area, a significant number of them are all trending in the right direction, that's a signal that a pandemic is about to break out and a hotspot is happening. Scripps has successfully tested this concept in their influenza-like illnesses detection recently, and it was quite effective in contact tracing the traditional social workers and then monitoring how the sensors and wearables are able to predict them. And there are several companies that are racing to be part of this. The leading research is from Stanford, Duke, and Scripps. To conclude, the barrier to innovation is only in your mind. The medical sensors and wearables are here to stay. There are some that are becoming part of this new normal. The pandemic only accelerated their development. The traditional annual physical exam to your doctor may be a thing of the past if a medical sensor, whether it is a wearable or a tattoo, is providing a long-term trend analysis to the doctor who can provide useful information by your friendly FaceTime or Google Duo. Thank you, and let's see if we have any questions. I had atrial fibrillation last year and got an Apple Watch. The heart rate monitor gave me anxiety. I can understand that. I noticed I would have one high, I think it is high reading on their heart rate when I looked at my watch. I wake up in the middle of the night to check. How can I balance keeping tabs on my heart rate without giving myself the anxiety? This is a great question. The anxiety with use will diminish. Humanity is highly resilient. It will collectively look back on all the experiences that you tracked. If you had 6 readings and all of them there was nothing major going on, the anxiety level will go down. I do suggest, however, heart rate alone is not sufficient. The more current Apple Watches allow you to actually record the rhythm. That is the atrial fibrillation, the EKG tracing. If you share that with your physician, and that physician can tell you, look, this high heart rate is a false alarm. This is not atrial fibrillation. This is a high heart rate because of some extra beats. So there are other ways to find out, and this may trigger a medical grade monitor that you wear as a patch for 2 weeks to verify. Sometimes a high heart rate at night could be the nightmare, or it could be sleep apnea. So there are some values in there.
That's the same person.
Okay. I have nights where my heart rate shows 160 for 30 minutes. Have you heard of inaccuracies with the Apple Watch? Yes, the Apple Watch needs to be worn snugly. If you can slide your little finger in the space between your forearm and the strap, means it is too loose. Snug fit reduces the artifact. The artifact can trigger a high heart rate. Older generation Apple Watches are prone for this. The newer ones are not. Next question. That's interesting. Do you recommend a plant-based diet, a vegan diet, or what kind of diet? The plant-based diets are becoming hugely popular. I used to think it was my teenage daughter's fad when she started doing it, but there is plenty of evidence coming. For the Western world, one important benefit of a plant-based diet is a 30% reduction in the chance of a colon cancer. Individuals who reduce the red meat and overall animal product intake and switch to plant-based diets automatically reduce their calorie, trans fat, and salt intake. And these benefits translate into cardiovascular benefits in the form of reduction in high blood pressure, diabetes has been shown, and the reduction in the risk of a stroke. So plant-based diets are important. They are not easy to follow if you have been a meat or ovo, egg product, dairy product eater. There are flexitarian diets. There are mixes. The most recently studied popular diet that I recommend is the Mediterranean ovo diet with the fish. So it is allowing, besides the vegetables, complex carbs in the form of old world biblical grains such as whole wheat, spelt, sorghum, barley, wild rice. All of them have very low glycemic index, high fiber intake, and they create satiety, which make you eat less number of calories. The presence of fish and egg products are also helpful. Pure plant-based diets suffer from 2 things. Their protein content is not sufficient. There are those who dispute that, I am sure. There are many legumes that are rich in plants with the amino acids and the essential breakdown products of the protein that we need. Many of the plant-based products are not complete proteins. Some of the essential amino acids are missing. Quinoa and soy perhaps are the good exception. But I don't necessarily think you need to be a pure diet fan of one or the other. Chances are you will get tired of it within 6 months, and then you try something else. And that, again, common principle would be portion control and then incorporate eat this, not that strategy. The most important thing we're recommending now in terms of diet is reduce the trans fats, reduce the salt intake in the diet, increase the fiber intake, space the meals so you naturally bring the size of the stomach down. I'm going to move on because we have plenty of other questions. I have heard to check your blood oxygen level with your Apple Watch using your finger instead of having it on your wrist. Is there a truth to this? I am not aware that you need a finger. The radial artery, that's where the Apple Watch is measuring, is pretty significant vessel that shows pulse fluctuations. The oxygen measurement as a function is now available for the first time in the Apple Watch 6. So you don't necessarily need it on your finger. Is Apple Watch more accurate than Fitbit or vice versa? They have done comparative studies. You can Google it and check. I believe they're more or less equal. The biggest challenge of activity monitoring is the steps that you take. Sometimes, depending on the amount of movement, the accelerometer averages. And if there is an artifact, it double counts. And eventually, Apple Watch and iPhone, if you carry them together, within a matter of half an hour, they will average it out. They have an algorithm for this. I don't think one is any more accurate than the other. Both of them suffer from accuracy when you are doing cycling and spinning. Because of the upper body being relatively stable, and you put your wearables in the relatively stable portion, but the Apple Watch has a program, and I believe Fitbit has as well. You can let the device know what type of exercise you're doing. It changes the sensitivity of the accelerometer, and then it is much more predictable. What's more important is actually the trending, not one absolute number. What is the day-to-day trend has been, and that's necessary. What kind of exercise program should I follow? The exercise should include a balance of cardio and strength and stretching. And that's the reason I like to bring in the old yoga, tai chi into play. The days are gone when you would be on a treadmill running nonstop. That gets to be boring, and the impact can damage the feet as well as the knee joints. So you need to vary it. You could do what is something that is much more popular now, and that is the high impact interval training. You can pick 3 to 4 routines and switch them every 2 to 3 minutes. And the goal is to keep at it and not take a break in between. And you could do this for a total period of 10 minutes, or if you want to start, just do it for 5 minutes and then take a break and then repeat the set. High intensity interval training has one major benefit. You can achieve your calorie burn and high heart rates in a shorter period of time. If you're time pressed, or if you think your motivation is fleeting, HIIT method is the right method for you. It is important to maintain the strength training with the resistance, because as we get older and the hormone changes, osteoporosis sets in. The best defense against osteoporosis, besides the vitamin D and the sunlight, is the strength training. When you train the muscle, and that will have a stimulatory effect on the bone cortex, and the bone strengthens. So it's not a surprise that someone who is muscular and physically fit will have strong bones. What kind of exercise I covered that. How common is AFib? Has the watch really been helpful in AFib detection? AFib is becoming the dominant rhythm once we're past the age of 75. It is not uncommon. We have hospital floors majority have atrial fibrillation. There are those that get the atrial fibrillation in spurs or episodes. We call that paroxysmal. There are those who keeps coming back with the episodes of AFib, that's the persistent, and there are those whose AFib is the permanent rhythm. As we get older, atrial fibrillation gets worse. As we gain weight, blood pressure not well controlled, if we have COPD emphysema, if we drink alcohol more than 2 glasses a day, and if we have sleep apnea. These are the modern Western world's curse in terms of AFib becoming the most dominant arrhythmia. AFib is relatively benign if the heart rate is controlled. The biggest problem with AFib is, of course, the risk of stroke. One thing unique about the strokes from atrial fibrillation, the strokes tend to be large. They tend to happen at night where the detection rate is low. So we don't know when the last known normal for that individual is. And when that happens, we don't have the time to intervene. And if we intervene with aggressive clot buster drugs, there is a risk of bleeding in the brain. So prevention is the key. Early detection is important. And in that regard, these wearable devices are going to play a big role. We are in the early phase of proving that Apple Watch type wearable is effective in detecting. In the beginning, doctors worried that we will have a deluge of false alarms. And interestingly, in the Stanford study, out of 450,000 people, very few actually panicked and called. So that issue about anxiety will normalize itself. I tend to recommend Apple Watch for monitoring atrial fibrillation. When someone says they're having palpitations and anxiety, it's actually a very good device. The tracing has better quality than the Cardia, and it is readily available on your wrist when you need it. The downside to it is you would need to stay on top of it when you have these symptoms. The biggest challenge with any of these wearables is, what if the AFib is something happening periodically and we're not aware of them? These are the so-called silent atrial fibrillations. Now remember, just like AFib being silent, many of the strokes are silent. They happen at nighttime. How do we go by detecting them? So when we look at the risk factor profile of an individual, is the person morbidly obese? Is the neck size greater than 17? That's a very good clue that they may have obstructive sleep apnea. Do they drink a lot? Is the blood pressure not well controlled? When I see these risk factors, I monitor them because I know they are the ones where AFib is likely to happen. So you can detect atrial fibrillation through medical grade monitors if they are silent. If they are felt by the patient, Apple Watch is sufficient. All right. Thank you all for attending. I hope you enjoyed watching this. And Hoag Hospital has an excellent arrhythmia program with several highly trained electrophysiologists and cardiologists fully equipped to diagnose any kind of arrhythmia. And we're in the process of doing clinical trials using the Apple Watch even to detect a heart attack. And please stay tuned